She was the ghost of the intensive care unit. He was the surgeon king who ruled it with a scalpel of fear. He decided to make an example of her, to break her silence. He never imagined a four-star general would walk past him, past the hospital director, and salute the quiet nurse first. Now, let me take you inside the sterile, high-stakes world of Sterling Cross Hospital, where the whispers are louder than the alarms. The air in the ICU was a carefully curated cocktail of scents, the sharp, sterile bite of bleach, the faint, sweet decay of sickness, and the expensive, cloying cologne of Dr. Alistair Finch. Alara Vance smelled him before she saw him, a fragrant harbinger of dread that made the fine hairs on her arms stand at attention. It was a Pavlovian response she had developed over the past 3 months, a silent internal alarm that tightened the muscles in her shoulders and neck. She didn't look up from the patient chart in her hands. Her focus remained on the looping script of the attending physician, deciphering the orders for the man in bed 3, a Mr. Henderson with a failing liver and a spirit that was fading just as fast. The hum of the ventilator was a steady rhythm section to the frantic beep of the cardiac monitor, a soundtrack she had long ago learned to interpret like a second language. A shadow fell over the chart. The cologne intensified. "Nurse Vance?" Dr. Finch's voice was smooth as expensive whiskey, but carried an undertone of something acidic, something that curdled the air. He didn't use her first name. He never did. It was a small, deliberate act of depersonalization, a way to keep her in her place. "Dr. Finch." She replied without lifting her gaze. Her own voice was low and even, a stark contrast to his theatrical baritone. She kept it that way on purpose. An unruffled surface betrayed no depths. "Mr. Henderson's potassium is elevated. I see you haven't administered the Kyaxalate I ordered an hour ago." It was not a question. It was an accusation, delivered for the benefit of the 2 junior nurses pretending to be busy at the nearby computer terminal. Alara finally looked up. She met his eyes, a shade of blue so pale they seemed almost translucent, and just as cold. He was a handsome man, the kind of handsome that graced the covers of magazines, sharp jaw, perfectly coiffed silvering hair, a bespoke suit that probably cost more than her car. But the beauty was a facade, a high-gloss finish on something rotten underneath. She had seen the way his smile never quite reached his eyes, the way his fingers would drum impatiently on a patient's bedside table as if urging them to hurry up and either live or die. "I was rechecking his renal function panels first, doctor," she said, her tone meticulously neutral. "His creatinine is climbing. Administering a potassium binder with his current kidney function could precipitate a more acute crisis. I was about to page you to suggest a shift to a temporary dialysis catheter." Silence. It was a thick, heavy thing. She could feel the attention of the other nurses, their movements frozen. They were waiting for the explosion. It was Finch's signature move, the public dressing down. He used humiliation as a tool of control, sharpening his authority on the embarrassment of his staff. Finch's perfect smile tightened. It was a predator's smile, all teeth and no warmth. He leaned in closer, invading her personal space, forcing her to tilt her head back slightly. The scent of his cologne was suffocating. "Are you a nephrologist, Nurse Vance?" he whispered. The sound of venomous hiss meant only for her, though its venom was potent enough to be felt by everyone in the vicinity. "Did you suddenly acquire a medical degree in the last 5 minutes that I am unaware of? Your job is not to suggest. Your job is not to think. Your job is to follow my orders, promptly and without question." He straightened up, his voice returning to its full resonant volume. "Now give the damn medication, or I will find a nurse who can." He turned on his heel and swept away, a king leaving his court, the wake of his arrogance rippling through the unit. The 2 junior nurses immediately busied themselves, their faces averted. No one met her eye. No one offered a word of support. They were a flock of sparrows, scattering at the first sign of the hawk. This was her life now, a cage of her own paranoia, walled in by the fear he cultivated. Alara stood there for a long moment, the plastic of the chart binder cool against her fingers. She could feel a flush of heat creeping up her neck, a hot tide of anger and shame. He had done it again, made her feel small, incompetent, a mindless drone. It was his specialty. He targeted the ones who wouldn't fawn over him, the ones who didn't laugh at his condescending jokes. He targeted the quiet ones. He had mistaken her silence for weakness. So many people did. She looked from the chart in her hand to Mr. Henderson in the bed. His skin was the color of old parchment, his breathing shallow. He was oblivious to the small drama that had just played out over his failing body. He was just a man, scared and sick, caught in the crossfire of a hospital's internal politics. Her jaw tightened. She walked to the medication dispenser, her movements stiff. Her training, the ingrained discipline of a past life, screamed at her. Following a potentially harmful order was a cardinal sin. It was a failure of duty, a betrayal of the person in the bed. But this was not that life. In this life, she was a nurse, a subordinate. Defiance meant her job. It meant being blacklisted by one of the most powerful physicians in the state. She had built this new, quiet life for a reason. She had sought anonymity, a place where she could heal people without having to fight a war. She hadn't realized the war would follow her here, just in a different uniform. She keyed in her code. The machine whirred and a small drawer popped open, presenting the cup of thick, chalky liquid. Kayexalate. The order. She took it. But she didn't walk toward Mr. Henderson's room. She walked to the small, windowless break room, a space that always smelled of stale coffee and desperation. She set the cup down on the counter and braced her hands on the sticky formica. She stared at her own reflection in the dark screen of the microwave. The woman looking back was a stranger. Her blonde hair was pulled back in a severe, functional bun. Her face was pale, her eyes shadowed with a weariness that had nothing to do with long shifts. She wore blue scrubs, a uniform of service and anonymity. There was no trace of the woman she used to be. No hint of the calloused hands, the sun-bleached hair, the eyes that had seen things no one should ever have to see. That woman would never have hesitated. That woman would have faced down 10 of Alistair Finch without flinching. A quiet voice from the doorway made her jump. "He's wrong, you know." It was Maria, one of the older, more seasoned nurses. She had the kind of tired eyes that had seen it all, but there was a flicker of kindness in them. She held 2 cups of coffee. "The patient's creatinine is 4.2, Maria continued, stepping into the room and handing Alara a cup. "You were right to question the order. Finch is just Finch. He can't stand it when a nurse is smarter than him, especially a new one." Alara took the cup, her fingers wrapping around its warmth. "Thanks." "Don't thank me. I didn't say anything out there." Maria's voice was laced with self-reproach. "None of us did. We're all cowards. He has the board in his pocket. One word from him, and you're on administrative leave pending an investigation. You'll never win. So we just let him hurt people?" Alara's voice was barely a whisper, but it was sharp with an edge she usually kept hidden. Maria sighed, a long, weary sound. "We do our best to mitigate the damage. We clarify orders. We accidentally delay things until we can get a second opinion from a resident. We document everything. It's an underground railroad of courage, honey. It's all we've got." Alara looked down at the cup of medicine on the counter, a symbol of her own cowardice. "It's not enough." "I know," Maria said softly, "but for now, it has to be. Just be careful. He's marked you. He'll be watching everything you do, waiting for you to make a real mistake." Maria left, and Alara was alone again with the silence and the smell of burnt coffee. She thought of the promise she had made to herself when she left her old life behind. No more fights. No more battles. Just quiet, simple healing. It had been a naive promise, a fool's hope. There were always battles. There were always men like Alistair Finch. She picked up the cup of Kayexalate, walked to the sink, and poured the thick liquid down the drain. She rinsed the cup, dried it, and disposed of it. Then she went back to the nurse's station, her face a calm, placid mask. She picked up the phone and paged the on-call nephrology resident. She would document it as a clarification. She would play the game. For now. The days that followed were a masterclass in psychological warfare. Finch was relentless. He assigned her the most difficult, most demanding patients. He would appear at her shoulder without a sound, his presence a cold weight, watching her every move as she titrated a complex drip or performed a delicate dressing change. He would interrupt her while she was speaking to a patient's family, correcting her terminology with theatrical condescension. He combed through her charting, searching for the smallest inconsistency, the slightest error. He found none. Her charting was a fortress, precise, detailed, and utterly professional. It was a skill honed in a place where a single misplaced word in an after-action report could have lethal consequences. Her meticulousness seemed only to infuriate him more. The other nurses watched from a distance, their sympathy mixed with a palpable fear. They were kind to her in the break room, in the hushed confines of the locker room, but on the floor, she was an island. Contact with her was a risk. Finch's displeasure was a contagious disease, and no one wanted to catch it. Alara retreated further into herself. The silence he had once mocked became her armor. She moved through the chaos of the ICU with an unnatural calm. Her hands were steady when drawing blood from a rolling vein. Her voice was a low, soothing constant during a painful procedure. The patients, oblivious to the politics swirling around them, responded to it. They trusted her. Their families asked for her by name. This, too, seemed to infuriate Finch. One afternoon, a code blue was called in room 7, a massive pulmonary embolism. The patient, a woman in her 50s, was crashing hard. Alara was the first one in. She didn't think. She moved. She slammed the button on the wall, grabbed the ambu bag, and started rescue breaths, her mind a cold, clear space of process and procedure. The room filled with people. A resident started chest compressions. Maria was pushing meds. And then Finch arrived, shoving his way to the head of the bed. "What's her oxygen saturation?" he barked. 82 and dropping, Alara answered, not missing a single compression of the bag. "Intubate," he commanded. The respiratory therapist moved in with the laryngoscope. The first attempt failed. The patient's airway was difficult. The monitor shrieked a flat line. "Damn it!" Finch snarled, snatching the scope. He was a surgeon by trade, not an intensivist, but his ego wouldn't let him admit he was out of his depth. He tried to force the tube. Alara saw a flash of red in the patient's mouth. He was causing trauma. "Doctor, you're causing edema," she said, her voice sharp and clear over the din. "You won't get the tube in that way. Let me." Finch's head snapped up. His eyes blazed with a fury that was shocking in its intensity. "Get the hell out of my way, nurse!" But Alara was already moving. In her past life, she had intubated soldiers in the dark, in the back of a jolting vehicle, with sand and blood in the way. This was clean. This was simple. She took the smaller alternative airway device from the crash cart, a laryngeal mask airway. It was faster, less traumatic. "We don't have time for a surgical airway," she stated, not asking. She pushed past the stunned resident and positioned the LMA at the patient's mouth. It was a move of such breathtaking audacity that the entire room froze. For a split second, the only sound was the useless wail of the monitor. With a smooth, practiced motion, she inserted the device. She attached the bag, gave a breath, and watched. The chest rose. "Saturation is coming up," Maria said, her voice filled with awe. 94%. We have a rhythm." A weak, thready pulse returned. The room exploded in a flurry of renewed, effective activity. They had pulled her back from the brink. Alara stepped back, her work done, melting back into the background. She felt the familiar, cold adrenaline recede, leaving a tremor in its wake. She had broken protocol. She had defied a direct order. She had shown her hand. After the patient was stabilized and transferred, Finch cornered her by the linen carts. He didn't shout. He didn't raise his voice. It was worse. His entire body was vibrating with a tightly controlled rage. His face was pale, his lips a thin white line. "You are finished," he said, his voice a low, guttural promise. "I'm going to the director right now. I will have your license. You will never work in this state again. You will never work as a nurse again. You humiliated me." The last sentence was the truth of it. The rest was just noise. It was never about the patient. It was about his pride. "I saved her life," Alara said, her own voice quiet, but hard as steel. "You got lucky," he sneered, "and it's the last time you ever will. Pack your things." He walked away. This time, Alara knew it wasn't an empty threat. She had crossed a line from which there was no return. She could feel the stares of her colleagues, a mixture of horror and a strange, nascent respect. She had done what none of them had dared to do. She stood there, feeling strangely numb. She thought she would feel terror or regret. Instead, she felt a profound sense of weariness. She had tried so hard to be invisible, and she had failed. The world just wouldn't let her be. If you were Alara in that moment, knowing your career was about to be destroyed for doing the right thing, would you have just walked away? Or would you have stood your ground and fought, even if you knew it was a losing battle? The call came an hour later. She was to report to the hospital director's office immediately. Maria gave her a quick, fierce hug in the locker room. "For what it's worth," she whispered, "you were magnificent." Alara walked the long, polished corridors to the administrative wing. The floors were carpeted here, absorbing the sound of her footsteps. The air smelled of wood polish and money. It was a different world from the raw, visceral reality of the ICU. It was the world where men like Finch thrived. She expected to find Finch and the director, a stern, humorless man named Mr. Davies, waiting for her. She was prepared for the lecture, the termination papers, the final formal humiliation. But the situation was different. The moment the door to the director's office opened, she knew something was wrong. The tension in the room was a physical force. Mr. Davies was behind his desk, looking pale and harried. Dr. Finch was there, yes, but he wasn't sitting in a position of power. He was standing stiffly by the window, his arms crossed, his jaw clenched, and there were other people in the room, 2 men in dark, severe suits who stood by the door like sentinels, and another man, an older gentleman with a kind but worried face, who was sitting in one of the visitors' chairs. "Nurse Vance, thank you for coming," Mr. Davies said, his voice strained. "We have a situation, a new admission, extremely high profile." A patient? Alara was confused. Why was she here? Why was Finch here? "Senator Thompson," the older man said, standing up. He was the senator's chief of staff. "He collapsed during a speech an hour ago. He's on his way here now. He's unstable." Finch finally spoke, his voice tight with resentment. "As I have already explained to everyone, my team is the best equipped to handle this. We will be taking the senator to the CVICU, and I will be personally overseeing his care." "That is the issue," one of the men in suits said. His voice was flat, devoid of emotion. "The senator's security detail has specific protocols. His care is a matter of national interest. We need assurances." Alara was still lost. "I'm sorry. I still don't understand why I'm here." It was Finch who answered, a cruel smirk playing on his lips. "Mr. Davies and I were in the middle of a meeting regarding your gross insubordination and reckless endangerment of a patient. This unfortunate interruption delayed your termination. Consider it a stay of execution." The door to the office opened again, and a harried-looking aide leaned in. "He's here. They're taking him to ICU 1. Suddenly, the room was in motion. Davies, the chief of staff, the men in suits. They all surged toward the door. Finch, with a last triumphant sneer at Alara, followed them. "Vance," Davies called over his shoulder, "you're on duty until your termination is processed. Get to the ICU. You'll assist as needed, and you will do exactly as you are told. Do you understand?" It was the final twist of the knife. He was going to make her watch, to be a bit player in the biggest medical event the hospital had seen in years, just before he threw her out. It was a power play of exquisite cruelty. Alara nodded, her face impassive. She followed the procession back to the world she knew, the world of beeping machines and the smell of antiseptic. The quiet of the administrative wing was replaced by a controlled chaos. The arrival of a VIP patient had thrown the unit into high alert. They had placed Senator Thompson in the largest private room, the one with its own waiting area. The place was already crawling with Secret Service agents, their dark suits a stark contrast to the scrubs of the medical staff. They spoke into their wrists, their eyes constantly scanning, assessing threats. One of them, a woman with a severe haircut, stopped Alara at the door. "ID," she said, her voice a clipped command. Alara held up her badge. The agent studied it, then her face, then nodded curtly. Inside, the scene was tense. The senator, a man Alara had only ever seen on television, was pale and unconscious on the bed, a web of wires and tubes already connecting him to the array of monitors. Dr. Finch was in his element, holding court, issuing a rapid-fire series of orders to the residents and nurses gathered around him. "I want a full cardiac panel, a tox screen, and a head CT. Stat, get cardiology down here now. Someone page neurology. I want continuous telemetry and arterial line monitoring. Let's move. People, let's move." He was playing the part of the brilliant, commanding doctor for his new, important audience. But Alara could see the cracks. His movements were too jerky. His voice was a fraction too loud. He was performing, not commanding. And his orders were a shotgun blast, a standard protocol for an undiagnosed collapse, but not targeted, not thoughtful. Alara stayed by the door, observing, her role reduced to that of a spectator. She watched the monitors, her eyes tracking the green and red lines, her mind interpreting the data. The senator's blood pressure was dangerously low, despite the vasopressors they were already pushing. His heart rate was erratic. Something was wrong. Something was being missed. "Pressure's dropping further," a resident called out. "He's not responding to the levo." "Increase the drip," Finch snapped, "and add a vasopressin line." Alara's eyes narrowed. More pressors. It was like whipping a tired horse. You could do it for a while, but eventually the heart would just give out. This wasn't a primary cardiac issue. The pattern on the monitor, the specific type of hypotension. It was something else. It looked like distributive shock, but not septic. Anaphylactic? No rash, no swelling. Her gaze swept the room, cataloging everything. The IV bags, the equipment, the people. Her training took over, the deeply ingrained process of threat assessment and situational analysis. What was out of place? Then she saw it. A small detail, insignificant to anyone else. On the IV pole, hanging next to the bag of saline, was a smaller bag. A piggyback infusion. The label was partially turned away from her, but she could see the first few letters. It was an antibiotic, a powerful, broad-spectrum one. "What's in the piggyback?" she asked, her voice cutting through the noise. It wasn't loud, but it had a quality of command that made several people turn. Finch shot her a look of pure venom. "It's a prophylactic antibiotic. Standard procedure. Now be quiet and stay out of the way." "Which one?" Alara pressed, taking a step into the room. "Does it matter?" he spat. "Yes," she said, her eyes locked on the monitor, where a new, more dangerous arrhythmia was starting to appear. "What is his allergy history?" A panicked silence fell over the room. The chief of staff, who had been watching from the corner, went white. "Oh my God," he breathed. "Penicillin. He has a severe penicillin allergy." Finch's face went slack with horror. He looked at the IV bag as if seeing it for the first time. The antibiotic they had hung, a common choice for undifferentiated sepsis protocol, was a penicillin derivative. They weren't saving the senator. They were killing him. "Stop the infusion," a resident yelled, lunging for the IV line, but it was too late. The senator's body arched on the bed. The monitor screamed a solid, piercing tone. "Ventricular fibrillation, cardiac arrest. He's coding!" "Get the paddles," Finch roared, his voice cracking with panic. "Charge to 200!" They shocked him, once, twice. The body jumped, but the flat line remained. "Push one of epi." They were following the algorithm, the standard steps of a code. But this wasn't a standard code. This was anaphylactic shock leading to cardiovascular collapse. Epinephrine was right, but it wasn't enough. "We're losing him," the chief of staff moaned, burying his face in his hands. Finch looked wild-eyed, his carefully constructed world crumbling around him in real time. He was frozen, a deer in the headlights of his own catastrophic mistake. Alara moved. She didn't ask for permission. She didn't wait to be told. She grabbed the emergency drug kit from the crash cart, her hands moving with a speed and certainty that was mesmerizing. She drew up a full milligram of epinephrine, not the diluted cardiac dose, the anaphylaxis dose. "What are you doing?" a resident stammered. "Intramuscular," she said, her voice ablade. "The IV access is compromised because of the vasodilation. It won't get to the heart fast enough." She plunged the needle into the senator's thigh, right through his trousers. It was a move straight out of a field medicine handbook. Fast, dirty, effective. "We need an H1 and H2 blocker. Now," she commanded. And to her own surprise, Maria, who had run in when the code was called, immediately started drawing up Benadryl and Pepsid. "And start a high-dose steroid drip." Finch finally snapped out of his stupor. "Vance, I told you to stand down. Security, get her out of here." But the Secret Service agents didn't move. They were looking at the monitors. They were looking at the one person in the room who seemed to know exactly what she was doing. "We have a rhythm," Maria said, her voice trembling. "Sinus tach, blood pressure is coming up, 80/40. It was weak, but it was there. He was back. Alara wasn't finished. "His airway is swelling," she said, pointing to the slight puffiness around the senator's neck. "The intubation failed before, it'll fail again. We need a cricothyrotomy tray, now." She was asking for a surgical airway, a procedure a nurse was absolutely, under no circumstances, allowed to perform. It was the final, uncrossable line. "Absolutely not," Finch shrieked, his face mottled with sweat and rage. "That is a surgical procedure. You will kill him." "He'll be dead in 3 minutes if we don't," Alara countered, her gaze as cold and hard as a glacier. "His throat is closing. Look at the sats." The oxygen saturation was plummeting again. The brief victory was being erased. "I'm the physician in charge here, and I forbid it," Finch yelled, physically moving to block her from the patient. He was making his stand. It was a fatal mistake. It was in that moment of absolute high-stakes standoff that the door to the ICU swung open with force. The chaos, the shouting, the frantic energy, it all evaporated. It was sucked into a vortex of sudden, absolute silence. Standing in the doorway was a man who seemed to have been carved from granite. He was tall and lean, in his late 50s, with a face that looked like it had been weathered by 1,000 storms. His hair was iron gray, cut brutally short. He wore the immaculate dress uniform of a 4-star general of the United States Army, his chest a dazzling, colorful billboard of military achievement. But it was his eyes that commanded the room. They were a piercing, intelligent blue, and they swept across the scene with an air of absolute, unquestionable authority. Behind him were 2 more men, colonels by their insignia, and a phalanx of more Secret Service agents. The air crackled with power. Mr. Davies, the hospital director, scurried forward, his face a mask of frantic obsequiousness. "General Thorne, we weren't expecting you personally. We have the situation under control." Dr. Finch, seeing his chance to reassert his authority in front of a powerful witness, also stepped forward, composing his features into a mask of grave concern. He extended a hand. "General, I'm Dr. Alistair Finch, Chief of Surgery. I'm leading the team. Senator Thompson suffered a sudden collapse, but we have stabilized him." General Marcus Thorne's gaze flickered over Finch's outstretched hand and dismissed it as if it were a piece of lint. His eyes continued their sweep of the room, taking in the monitors, the crash cart, the terrified faces of the residents. He was not just looking, he was assessing, analyzing, processing. It was the look of a man who had commanded battlefields, who could absorb a complex, chaotic situation in a single sweeping glance and understand its fundamental truth. His eyes landed on Alara. She was standing by the patient's head, a scalpel from the cricothyrotomy tray she had demanded now in her hand. Her knuckles were white. Her face was pale, but set with a grim, unyielding resolve. Her eyes met his across the room. The world seemed to slow down. For a fraction of a second, no one moved. No one breathed. Finch stood with his hand awkwardly hanging in the air. Davies looked like he was about to have a stroke. General Thorne's entire posture shifted. The hardness in his eyes softened, replaced by something else, recognition, respect, and something that looked almost like relief. He ignored the doctor. He ignored the director. He took 3 long, deliberate strides into the room, his polished shoes making no sound on the linoleum floor. He walked directly toward the quiet, insubordinate nurse in the plain blue scrubs. He stopped 2 feet in front of her. And then, in the dead silent, astounded room, General Marcus Thorne, commander of the Joint Special Operations Command, brought his right hand up in a salute so sharp, so precise, it seemed to cut the air. His fingers touched the brim of his cover, his arm a perfect 90-degree angle. It was a gesture of profound, unambiguous respect, a salute given not to a subordinate, but to an equal, or perhaps to a savior. "Captain," he said, his voice a low, gravelly rumble that filled the entire room. It was not a question. It was a statement, an acknowledgement. "Report." Alara's shoulders, which had been tensed for a fight, relaxed by a fraction. A flicker of the woman she used to be surfaced in her eyes. She didn't return the salute, that was not the protocol, but she straightened her posture, her spine becoming a rod of steel. The scalpel was still in her hand, but she held it now not as a desperate measure, but as a tool she was qualified to use. She gave her report. Her voice changed. The quiet, hesitant nurse was gone. In her place was a voice that was clipped, precise, and utterly confident. It was the voice of a soldier briefing a commanding officer. "Sir, patient is Senator Thompson, male, age 68, presented with sudden collapse. Initial assessment in this facility was flawed. Patient was inadvertently administered a penicillin-class antibiotic, to which he has a known severe allergy. He progressed to anaphylactic shock and subsequent cardiac arrest." A collective gasp went through the room. The chief of staff let out a strangled sob. Finch's face, which had been red with fury, was now the color of ash. Alara continued, her eyes locked on the generals. "Code was initiated per ACLS protocol, but failed to achieve ROSC. I identified anaphylaxis as the primary cause, administered 1 milligram of epinephrine IM, and initiated H1/H2 blockade, achieved return of spontaneous circulation. Patient is now experiencing secondary airway compromise due to laryngeal edema. Oxygen saturation is 81% and falling. He requires an immediate surgical airway. I was preparing to perform an emergency cricothyrotomy when you arrived," she finished. The report was a clean, brutal summary of the facts. It was also a damning indictment of Alistair Finch. She had not accused him directly. She had not needed to. The facts spoke for themselves. General Thorne held her gaze for another long moment, his expression unreadable. Then he lowered his salute. He turned his head slowly, deliberately, until his icy gaze landed on Dr. Finch. The silence in the room was now a living thing, heavy and suffocating. "Dr. Finch," the general said, his voice dangerously soft. "You are the chief of surgery?" Yes. General, there has been a misunderstanding. This nurse," Finch began, his voice a desperate, blustering mess. "There is no misunderstanding," Thorne cut him off, his voice dropping another 10 degrees. "I asked you a question. Are you the physician in charge of this fiasco?" "I am the physician in charge of this unit. Yes," Finch said, trying to regain a shred of his shattered dignity. "Then you are the man who nearly killed my friend," the general stated, each word a perfectly placed shot. "You are the man who administered a known allergen to a patient, and you are the man who stood in the way of the only person in this room who knew how to save his life." He took a step toward Finch. The two colonels behind him subtly shifted their positions, flanking him. It was a classic military maneuver, an unconscious act of closing a cordon. Finch was no longer just a doctor, he was a threat. "General, I assure you, hospital protocol." "I'm not interested in your protocol," Thorne hissed, his voice a whip crack. He gestured with his chin toward Alara. "This is Captain Eleanor Vance. For 3 years she was the senior combat medic attached to SEAL Team 6. She has performed cricothyrotomies on my men in the middle of firefights with nothing but a pocket knife and a ballpoint pen. She has kept men alive with half their bodies blown away. She has stood over my own son on a battlefield in Kandahar and brought him back from the dead. Her judgment in a medical crisis is worth more than every degree and accolade you have hanging on your wall." The revelation hit the room like a shockwave. Every eye turned to Alara, the quiet nurse, the ghost of the ICU. A captain, a combat medic for the most elite unit in the world? It was impossible, it was unbelievable, but the proof was standing right there, in the form of a 4-star general who was now looking at Dr. Finch as if he were something vile he had scraped off his boot. Thorne turned to Mr. Davies, the hospital director, who looked as if he was about to faint. "Director," the general's voice was now cold, hard, and official. "This hospital has just committed an act of gross negligence that has endangered the life of a United States senator. Dr. Finch is to be removed from this room and from this case immediately. He is not to have any contact with Senator Thompson or his chart. Is that understood?" "Yes, General, of course. Immediately," Davies stammered, frantically waving at the Secret Service agents. "Furthermore," Thorne continued, his voice relentless, "I want a full investigation into this event. I want to know how this happened, and I want to know why a decorated officer with Captain Vance's skills was being systematically harassed and scheduled for termination by this incompetent." The word hung in the air, a final brutal nail in Finch's professional coffin. 2 agents stepped forward and flanked Finch. He looked from the general to Davies to Alara, his face a grotesque mask of disbelief and impotent rage. "This is an outrage," he sputtered. "I will not be treated this way. I will call my lawyer. I will call the board." "You do that," General Thorne said, turning his back on him, the ultimate dismissal. "Tell them to call me." The agents took Finch by the arms and escorted him from the room. His blustering threats faded down the hallway. The king had been deposed, publicly, utterly. The spell was broken. The room came back to life, but the atmosphere had fundamentally changed. The fear was gone, replaced by a stunned electric awe. General Thorne turned back to Alara. The hardness in his face was gone again, replaced with a deep, weary concern. "Captain, the airway." Alara nodded. She turned back to the senator. The scalpel felt different in her hand now. It was not an act of rebellion. It was an instrument of her expertise. "Let's save his life," she said, her voice calm and clear. And this time, everyone in the room moved to help her. The aftermath was swift and decisive. With Alara directing the care, supported by a now attentive and respectful team, they stabilized Senator Thompson completely. The cricothyrotomy was performed cleanly and efficiently by a trauma surgeon who arrived minutes later, but everyone knew she could have done it. Everyone knew she had been right. The senator was moved to a specialized unit, his prognosis now excellent. The investigation General Thorne had demanded was less an investigation and more a formality. With the testimony of the general, the senator's chief of staff, and half a dozen ICU nurses who finally felt safe enough to speak, Alistair Finch's career did not just end. It imploded. He was fired. His medical license was suspended pending review, and whispers of a criminal negligence charge began to circulate. His corruption, the little kickbacks and covered-up errors Maria had spoken of, all came to light under the intense scrutiny. His reign of terror was over. 2 days later, Alara was once again summoned to the director's office. This time, the atmosphere was entirely different. Mr. Davies stood when she entered, a strained but respectful smile on his face. General Thorne was there, sitting in one of the chairs, dressed in civilian clothes. He looked less like a weapon and more like a concerned friend. "Nurse Vance, Captain, please, have a seat," Davies said, gesturing to the chair next to the general. The use of her old title was clumsy, but the effort was clear. Alara sat. She felt a quiet, exhausted relief. It was over. "First," Davies began, "on behalf of the entire hospital administration, I want to offer you our most profound and sincere apology. What you endured at the hands of Dr. Finch was unacceptable. It was a failure of our oversight, and we are taking significant steps to ensure it never happens again." Alara simply nodded. She didn't need the apology, but she understood the necessity of it. "Second," Davies continued, sliding a folder across the polished desk, "we would be honored if you would consider staying on at Sterling Cross. Not just as a nurse. Your unique skill set has been brought to our attention." He glanced nervously at General Thorne. "We are creating a new position, Director of Clinical Crisis Management and Patient Safety. It would report directly to me. You would have the authority to intervene in any case where you perceive a critical risk. You would oversee training, protocol development. Essentially, we want you to be our watchdog, to be the person who sees what others miss." It was an incredible offer, a complete reversal of fortune, from termination to a directorship, from a victim to a protector. She looked at the general. He gave her a small, almost imperceptible nod. The decision was hers, but he approved. "I accept," she said, her voice even. Davies looked immensely relieved. "Excellent. We'll have HR draw up the paperwork immediately. Your salary will be commensurate with the position, of course." After the meeting, as she and the general walked down the quiet, carpeted hallway, he finally spoke. "I got a call from the senator's security lead," he said, his voice low. "They heard a code blue and the name Finch in the same sentence and knew something was wrong. They have a file on him. Apparently, he was dishonorably discharged from the Army Medical Corps 20 years ago for falsifying records. They flagged my office as a courtesy, knowing my connection to the senator." He shook his head. "I just never imagined I'd find you in the middle of it." "I tried to be quiet, sir," she said, a hint of her old weariness creeping back in. "I tried to leave it all behind." "Some people aren't meant for the quiet, Captain," he said gently. Some people are meant to stand on the wall. You just tried to build your wall in a place you thought was safe. Turns out, the battle finds you no matter where you go. They stopped at the main entrance of the hospital. The afternoon sun streamed through the glass doors. Will you be all right, Eleanor? He asked, using her first name for the first time. She looked at her own reflection in the glass. She was still wearing the blue scrubs, but they looked different now. They no longer felt like a costume of anonymity. They felt like a uniform. Her uniform. Yes, General, she said, and for the first time in a long time, she smiled. It was a small, tired smile, but it was real. I think I will be. He smiled back, a rare and genuine expression that transformed his hard face. Good. The world needs more watchdogs, and if you ever need anything, you have my number. He turned and walked away, a quiet man in civilian clothes who could command armies. Alara watched him go, then turned and walked back toward the ICU. Not to the locker room to pack her things, but to the floor. Her floor. When she walked through the doors, the familiar symphony of beeps and hums greeted her. But something was different. The nurses at the station looked up. They smiled at her. Maria gave her a thumbs up. The residents nodded respectfully. The silence that had once isolated her was now a mark of her strength. They no longer saw a timid, quiet nurse. They saw a woman who had faced down a tyrant and won. They saw a leader. She walked to the large window overlooking the unit, her new domain. She was not a ghost here anymore. She was a guardian. The battle had found her, and she had not flinched. She had stood her ground, and in doing so, she had found not the quiet life she thought she wanted, but the purposeful one she had always needed. She was not a hero. She was not a victim. She was a professional, and her work was just beginning.